All right, today we're diving into one of the most powerful diagnostic tools out there, the cardiopulmonary exercise test, or CPET. You can think of it as the ultimate fitness test, and we're going to break down exactly how it gives us such a detailed look inside the human body. So let me ask you a question. Have you ever wondered what your body's absolute peak performance really is? I'm not just talking about how fast you can run a mile, but what are the actual hard limits of how your systems work together when you're pushing them as hard as you can go? Well, you measure it with the ultimate stress test. See, the CPET is considered the gold standard for a reason. It's not just looking at your heart or just your lungs. It's measuring how your heart, your lungs, and your muscles all work together as this single, incredible system under stress. It really does tell the complete story. So here's our game plan. We're going to go on a little diagnostic journey. First, we'll see how you even know if the test is valid by gauging maximum effort. Then we'll get into the good stuff, measuring the body's peak power, figuring out when it crosses the anaerobic threshold, and then playing detective to see if the limit is the heart or the lungs, before putting it all together to read the full story. Okay, first things first. Before you can even think about analyzing a single piece of data from this test, you have to answer one absolutely crucial question. Did the person actually give it their all? I mean, if they didn't push themselves to their true limit, then all the results that follow are kind of meaningless, right? To figure this out, clinicians have a super reliable 3-point checklist. They look at the physical work the person did, the heart rate they reached, and this cool metabolic marker called the RER. So let's see how our case study patient stacked up. The first check is pretty straightforward. The software predicts a maximum workload based on the patient's age, height, and so on. The goal is simple. Did the patient achieve at least 80% of that prediction? And the answer for our patient? Oh yeah, the prediction was 178 watts, but they pushed all the way to 221 watts. That's 124% of what was expected. So checkpoint 1 is cleared with flying colors. Okay, next up, heart rate. The target here is to get over 80% of their predicted maximum heart rate. And that's usually estimated with that classic formula you've probably heard of, 220 minus your age. So our patient is 47 years old, which gives them a predicted max heart rate of 173. During the test, they hit 166 beats per minute. That's 96% of their max. So another easy pass. Check 2 is done. Now for the most, let's say, technical check of the three. The respiratory exchange ratio, or RER. This is just a ratio of the carbon dioxide you breathe out versus the oxygen you take in. See, when you're going all out, your body starts producing way more CO2 than the oxygen it's using, and that drives this ratio way up. The magic number we're looking for is anything above 1.15. And our patient absolutely crushed it, hitting an RER of 1.32. So with all three of those boxes ticked, we can say with total confidence, this was a maximal effort test. The data is legit, and now we can start digging in. All right, now that we know the test is valid, we can get to the first huge finding. And this is arguably the single most important number you can get from a CPET for measuring aerobic fitness, the VO2 peak. So what on earth is VO2 peak? Put simply, it's the maximum amount of oxygen your body can take in and use every minute. I love this analogy. Just think of it as the horsepower of your body's engine. The higher the number, the more powerful that engine is. So in a healthy person, as the work gets harder on the bike or treadmill, their oxygen use should go up in a nice, steady, straight line. You know, it's like pressing the gas pedal in a car. It just smoothly accelerates. But what if that line just flattens out way too early? That early plateau, well, that's a major red flag. It's telling us that something, somewhere, is stopping the body from getting or using more oxygen, even though the muscles are screaming for it. The engine is hitting its red line way too soon. And doctors grade this really precisely. It's not just a pass or fail. Based on what percentage of the predicted VO2 peak a person actually achieves, their exercise capacity is classified as having a mild, moderate, or even severe impairment. It gives a really clear, objective score. Okay, so now we know the engine's maximum horsepower, that VO2 peak. The next big question is, at what point does that engine have to switch gears? When does it go from using its most efficient fuel to a less efficient kind of emergency fuel? This critical point is called the anaerobic threshold. Honestly, here's the best way to think about it. For most of the test, your body is humming along in this super efficient aerobic state. Think of it as marathon mode. But at a certain point, the intensity gets so high, it just can't get enough oxygen to the muscles anymore. It has no choice but to switch into a much less efficient anaerobic sprint mode. And that exact moment of the switch, that's the threshold. So, to get a little more technical, the anaerobic threshold, or AT, is the point where your cells have to start making energy without enough oxygen. A byproduct of this is lactic acid, which your body tries to buffer, and that whole process leads to this big surge in CO2 that we can actually measure in the breath. And having a low threshold, meaning you hit that sprint mode really early in your workout, is a huge diagnostic clue. It could point to something as simple as being out of shape, deconditioned. Or it could be a sign of more serious underlying problems, like poor oxygen delivery from the heart or lungs, anemia, or even issues with the muscle cells themselves. So at this point, we've established that there's a limitation, and we know when the body is forced to switch gears. The next step in our little investigation is to figure out why. What's the bottleneck? Is it the heart's fault that it can't pump enough blood? Or is it the lungs' fault that they can't supply enough oxygen? And the great thing about the CPET is that it gives us specific clues for each one. For a cardiac limit, we're looking at things like an abnormal heart rate response or a plateau in something called the O2 pulse. For a lung or ventilatory limit, we look for something called a low breathing reserve. Let's just quickly break down what those last two really mean. First up, O2 pulse. It sounds a little complex, but the concept is simple. It's basically asking how much oxygen is your body getting to use with every single beat of your heart. It's a great stand-in for stroke volume, how much blood your heart is pumping. In a healthy test, this number should keep climbing and climbing. But if it just flattens out, that's a huge sign the heart can't keep up with demand. It points the finger directly at a cardiac limitation. And now for the lungs. For that, we look at breathing reserve. This is just a comparison between your absolute maximum breathing capacity and how much you're actually breathing at your peak effort. A healthy person should have plenty of room to spare, a reserve over 15%. But if you're using, say, 90% of your total lung capacity, you've basically run out of breath. A low reserve like that is a very strong sign that the lungs are the real limiting factor. So as you can see, the CPET isn't about finding one single magic number. It's about taking all these different data points, the effort, the peak power, the thresholds, the specific clues, and weaving them all together into a complete story and narrative of how your body performs under pressure.
And this is the exact process, the 5-question checklist that a clinician follows every single time. 1. Was the test valid? 2. How big is the engine? What's the peak VO2? 3. When did the body hit that metabolic wall? 4. Are the clues pointing to the heart? And 5. Or are they pointing to the lungs?
From figuring out if a patient is safe for surgery to designing training programs for elite athletes, the CPET gives us this incredibly detailed picture of health and performance. It really makes you wonder, doesn't it? What kind of story is your body just waiting to tell? Thanks for joining me on this deep dive.